What's up, everybody? It's your girl Meagan, and it's day 3 post ACL surgery. Today, I'm going to talk about medication, what I'm on, what my doctors prescribed me, why they did it, how I reacted to it, how maybe you may react as well, just so you guys have an inside scoop. If you are going into surgery, things do affect people differently, but maybe this is how it affects you. So, for me personally, I do not like taking medication. I would rather kind of go through the pain a little bit. But of course, this is a surgery where they cut open my leg. So it's going to be painful. So obviously, for the first couple of days, I do take those painkillers. But after that, I kind of wean down and don't do it because of the side effects. So the first one that my doctor prescribed me oxycodone. And he said for me to take 1 to 2 tablets by mouth every 4 hours if needed. Now, there's a big red label on here. These are things that people could overdose on or get addicted to. You have to be very cautious with this. So with this being said, even when I did take these, I only took one. I waited to take it maybe 6 hours or so because how it may affect you. Now for me, I don't really take medication at all. Maybe I'll take ibuprofen here and there if I have a severe migraine, but not used to it. So when I took these, got super tired, super drowsy, wasn't able really to function that well. So didn't really like it, and that's why I don't like taking them much. And that's why I still have a lot in this bottle. Not going to finish it. Next one I have is for antibiotics. So this is very important to take, making sure that I don't get any infection. This is cephalexin. Not sure to say that properly, but I'm supposed to take 1 capsule by mouth 4 times a day for 7 days. Next one I have is aspirin. Now, this one is an over-the-counter one. When I went to pick up my medication, they didn't have the aspirin ready for me, so I just bought some in store. So I could have gotten probably the bottle that looks like what they're talking about, but I just grabbed the bottle that had the specifics like they mentioned. So it's 325 milligrams, 1 tablet every morning, and this is going to be for blood clots. So I'll take this for 28 days, which is also why you have to be cautious if you are traveling airfare. Make sure you always consult with your doctor because you are more prone to get blood clots and you do not want that. The next one I have ibuprofen. Now I have taken ibuprofen before. Usually they're small tablets. These guys are huge. They're like freaking horse tablets. I'm not sure what they are. And I'm not really good at taking pills in general. So this is sometimes hard for me. But this one I'm supposed to take 1 every 8 hours with food or milk if needed. Now this is also can be helpful for pain, but it's also to make sure for inflammation. So I do have a lot of inflammation in my knee right now. It's still pretty swollen. So I'll take this until that swelling pretty much goes down. And also if there is pain, but the pain does kind of simmer down after the first 3 days or so, I would say. And then the last one, this box, which I have not opened, will not open. It is ondansetron. Have no idea if I pronounce that right or not, but it's for nausea. So I take 1 tablet. They put it on the tongue every 8 hours if needed. I'm not sure if you guys have ever taken this. I haven't taken it for surgery before, but took it. I'm not sure exactly recall why, but I feel like I was more nauseous with it, so just didn't take it. These are all medications that were prescribed to me by my doctor in order to take, and it's very important that you follow what it says. So if it says take it every 6 hours, every 8 hours, every 4 hours, if it's specific on that, make sure you do that. And for the amount of times you have for the day, especially in the early stages, because like I said, there's some antibiotics and stuff, the aspirin for blood clots, you don't want to mess with that. So for me, because of that result, I set timers on my phone specifically that would set the different times that for each of these when I have to do it. So every time I took it, I reset it to the next time that I had to take it because I wanted to be on time. And so for the first day when I had all this medication after the hospital, it was a little bit off, obviously, because they gave me stuff. So I was taking medication, I think 12 o'clock, 1 o'clock in the morning, maybe even 2 o'clock in the morning, I think, because the time difference of all these, but then got back on track once I was possible. So those are the things are needed. I'm definitely going to take. Now, if needed, like the painkillers, these guys, once again, do it as needed, but you do not need to take it. So for me personally, I'm not sure if you guys don't like taking medication or if you haven't, it may affect you because they are super strong. I don't normally take medication. It is strong medication in general. So just be cautious if you're doing so. Obviously, the first day, you definitely want to because when the procedure is done, your leg is going to be in the most pain if you don't take it the next day when you wake up. So you need that in the system. You're not going to take it and then it's going to act right away. So if you want to take it because you have pain right now, it's going to take a little bit of time before that actually works. This is just my insight about medications. Once again, always ask your doctors. I'm not a doctor. I'm just letting you guys know what I was prescribed for my procedure. I've been given different painkillers for my other ACLs as well, but all along the lines, same thing. Painkillers, what they're supposed to do, another one for blood clots, another one for inflammation and stuff like that. So hopefully you found this helpful. And don't forget to like, comment, share, and subscribe so you do not miss out on any new content that I have on this recovery process. And like I said, if you guys really want to see something about this that I haven't touched up on or maybe go a little bit further in, go ahead, feel free to comment below or message me on Instagram at ACT7VE, as well as my email, Meagan@showupfitness.com, so I can make sure I have all your answers squared away. And once again, thank you for following my journey. Thank you for watching. And it's your girl, Meagan, out of here.